Hi, I'm Dr. Gopi, an interventional cardiologist at Fortis Hospital, Cunningham Road. 29th September is celebrated as the World Heart Day. Now, you would ask, why have a World Heart Day? Heart and its associated illness, which we call as cardiovascular disease, is the major killer in the world. Almost 17 million deaths occur every year due to cardiovascular illness. Cancer coming a distant second with about 8 million. So with this we can understand what is the impact of cardiovascular illness on the public. Now one thing that is good about cardiovascular disease is that it is hugely preventable, and because it is a lifestyle illness, change in our lifestyle can have a significant impact on the outcomes in terms of prevalence and incidence of cardiovascular disease. Now, if you look at what is happening in the developed world, we find that actually, though the numbers are huge, but actually the incidence of cardiovascular disease is coming down. But unfortunately, in our region of the world, that is the SAARC countries, there is an increase in the deaths and the prevalence and incidence of cardiovascular diseases. So we need to, get our act together and take as much preventive steps as possible to try to, contain this. So how do we do it? I think public education is the most important. So the World Heart Federation has been, has taken up this challenge of trying to impart knowledge to the public, and every year they've been having different messages to try and tell us how important it is and how we need to take action regarding the preventive measures. So this year they have given a logo and theme as Share the Power. What do they mean by that? That each individual who understands what are the factors that are required to prevent heart disease should make it his bound duty to inspire another individual or people in his family. Thus, the message what we tell to one person gets transmitted or gets imbibed by many people, and that would be the surest way of how we can spread this message fast. So what do we mean by Share the Power? What are the components of it? It would mean eat right, do right exercises, and also avoid your bad habits. So eat right. I think we all, for years together we have been telling eat less of fat, less of carbs, more of protein. That's been the mantra as such. But of late, newer research has shown that we need to really concentrate largely on trying to reduce the carbs and especially direct sugars. It is being more and more understood that probably direct sugars are probably the major detrimental factors or major factors which implicate or which bring out cardiovascular disease in people, even compared to fat. So probably in future, in time to come, the advice regarding diet may have a slight change. We were always telling stick to about 20% of your energy coming from fats. Probably in time, in a couple of years, we might get advice saying up to 30% may be all right. So probably fat is not as bad as what we thought, though that doesn't give us the liberty to sort of binge on how much of a fatty food, fried things, and everything. We still need to keep it under control, but a lot of stress is going to be on direct sugars, all those processed foods, your chocolates, sweets. All these things are going to need to be curtailed for us to improve our cardiovascular health. Then exercises, I think, always been a major factor in trying to control the cholesterol levels, control your body weight, control blood pressure, control of diabetes. And then bad habits, especially the use of tobacco, is one of the major factors that are responsible for cardiovascular illnesses. So I think no tobacco in any form. You should ban tobacco in all forms. So I think if we understand this and take it upon ourselves to educate somebody close to you, your loved ones, your dear ones, your friends, I think that will have a major impact in us collectively being able to bring down the cardiovascular burden in our side of the world. Thank you.